Hello, my name is Angela Dossett. I'm a psychiatric mental health nurse practitioner. While working at the University of Iowa Hospitals and Clinics as a registered nurse, I was certified in both psychiatric mental health nursing and medical surgical nursing. I am lead author of our article, Yoga as an Evidence-Based Practice Innovation for Hospitalized Patients with Acute Medical and Psychiatric Illness. My co-author, Dr. Laura Colin, and I were awarded the 2021 Nurse Faculty Scholars Mentored Writing Award from the American Journal of Nursing. The article was an absolute collaboration between myself and Laura along with our team. With my expertise in yoga and her expertise in writing, we made for a fabulous collaboration. One of the reasons I wanted to publish was because I wanted to add to the body of evidence supporting yoga practice, especially for psychiatric inpatients. We felt that publishing in the American Journal of Nursing was a great opportunity to spread the word. How did I come up with this project? I had been instructing yoga for most of my life, and I have taught from the very young to the very old. The effects of yoga are fantastic. Each person comes into yoga on their own, meaning the benefits of yoga can be realized both physically and mentally, and it's individualized. I came up with this project because I was working as a staff nurse on our med-psych unit, which treated medical and psychiatric illnesses. While working with this patient population and witnessing the stress that they were experiencing, I thought, how could we help these patients better cope with being on a locked unit? What coping skill could we give them to take home with them? How can we as an organization better serve this population of patients? Our patients on this unit were acutely ill and could not or would not attend traditional groups for various reasons, whether they were manic, paranoid, depressed, hopeless, riddled with anxiety, decreased concentration, or the ability to focus. My knowledge and expertise of the benefits of yoga led me to approach my nurse manager to describe the many benefits of yoga and my plan to be able to teach yoga to our patients. She referred me to the evidence-based practice internship, which was starting around the same time. I applied for the internship and was accepted. One of the first tasks of EBP to see if there was enough evidence to support yoga practice. The evidence supported yoga for being effective and safe. I wanted to take advantage of this opportunity because of the potential benefits of yoga and because of my strong commitment to improving the patient experience while simultaneously improving their mental health. My end goal was to have yoga relaxation classes on every psychiatric unit at the University of Iowa Hospital and Clinics, and to make a permanent position for a nurse yoga instructor to teach this intervention. I had enough personal experiences and stories to share with leadership for approval for this intervention and also to motivate the team. Leadership in our institution wanted to support me and my commitment to the patient. On the psychiatric units at our hospital, there are large dining rooms that I thought would be perfect for small yoga classes. I have my own music that I like to teach with, and the only other thing that we needed were supplies. This is a very low-cost project. Patients need to have comfortable clothing to be able to stretch and move. Sweatpants and a t-shirt were offered. This was also a motivating factor to get patients to try yoga or relaxation class. We also needed a yoga mat. The classes were taught on a med-psych unit, all-adult psych units, geriatric psychiatry, pediatric psychiatry, as well as our crisis stabilization unit. This intervention focused totally on patient-centered care. Modifications need to be made for endurance, medical and psychiatric comorbidities, and physical limitations, so therefore chair yoga was taught a lot of the time. I had a paraplegic patient in his bed, and I modified the practice for that as well as using chair practice. The interdisciplinary team was vital to this project because they helped with surveillance and expert observation of the patient. They promoted yoga, and I would assess the patient, talk to staff, and to see who would be appropriate for this intervention. The very important thing is that I gave all patients an opportunity to participate, no matter their medical or psychiatric condition. Some patients were too psychotic to be able to follow instructions for a full yoga practice, so a lot of times I would just do meditation, relaxation, after simple stretching. It is important to know that these patients also had positive results from the practice. Some of the results that we realized were patient stories. So while teaching on the crisis stabilization unit, a young person, 19 years old, was experiencing both auditory and visual hallucinations. And when we finished the yoga practice, she said that the voices were silent. I think that's amazing because medications don't even do that. Another client that I had was paranoid schizophrenic, and his disease was so bad that he had self-harmed and made himself blind. I did one-on-one sessions with this patient. He memorized the yoga poses, and pretty soon, after a few weeks, he was able to do a practice on his own, and he left our hospital with a mat to take home with him. I had another patient who was tachypnic and had chronic COPD with great anxiety, and we did a chair yoga practice in a group, and I had to open up my eyes during that practice to see if she was still breathing because just the ujjayi breathing brought her down that much. If you would like more information about the process, our intervention, and the results from this project, I would refer you to our article. Thank you.